I just showed you 40 different skin conditions, including acne, eczema, rosacea, and sweet syndrome. The last 5 were mine. Thankfully, I'm able to get the proper medication to treat mine. But what about others who can't? Let's look at some different prices for skincare products, which are basic necessities: face wash, moisturizer, and sunscreen to protect your skin from the UV of the sun, which causes cancer. These are just basics that might help prevent acne. But what about other skin conditions that do not have over-the-counter medications or treatments? There are over 2,000 recognized skin conditions, ranging from commonly occurring conditions such as acne to rare conditions such as vitiligo. And many of these skin conditions are very painful, and some are even life-threatening. I interviewed professional dermatologist Dr. Tara Rower and asked a few questions about her clients affected by the pricing of treatments for their conditions. Let's see what Dr. Rower has to say. Do prices of products affect the decision of receiving treatment for your patients?
People are super conscientious about price and things today, whether that be over-the-counter stuff or prescriptions. I would say in a dermatology practice, I see it a lot with prescriptions. As soon as we start talking about medications, I would say almost half the time people are like, is it expensive? That's what they want to know. Or is my insurance going to cover it? Or is that, something they cut, things like that related to something related to price for sure. They want to know if it's going to be affordable. Sometimes they won't ask. Some people go as far as bringing their insurance book in with them that tells them, where they will like, hold on, let me look that medicine up and see what tier it is to see if it's going to be something that they think is reasonable.
What are your highest price treatments for skin conditions, and what are they helping? And the price of them as well.
Okay. I would say the most expensive things that we deal with are biologic medications. So what those are medications that are formulated using like proteins that they have to be injected. So it's all the medicines you see the commercials for and on TV, online. It's all the ones for psoriasis, some for eczema, some for hidradenitis. But basically they're injected medications that people use to like combat a really serious or bad condition. It can literally be a game changer, a lifesaver. It can help with joint pain, things like that. So they're very effective, but the cost is insane. If people were to pay out of pocket, I know they're at least $10,000 a year, but I think really most of them are in that $30,000 to $40,000 a year. So absolutely no one can even people who are like, oh, I make good money, they can't afford those.
The average U.S. income in 2025 is $61,984. And as Dr. Rower stated, biologic treatments can cost more than $10,000 a year. That is more than 15% of the average salary just for skin treatments. Has anyone refused treatment due to the price of prescription?
Oh yeah, every day. I work out of our we have like a box in our charting system that is our patient questions, and I would say, several of them are just like patient called or patient's mom called, too expensive, and sometimes we get those phone calls, and sometimes people don't call at all.
So how can Americans bring down the cost of healthcare? The American Journal of Medicine gives a detailed description on how Americans can reduce the U.S. healthcare cost, including reducing administrative cost, focusing on preventative care, eliminating unnecessary tests and procedures, and controlling the cost of prescription drugs.